athletic field. He's sitting down on a bench. I understand my scenario, 10 minutes. I know I got help, okay? I'm going to go ahead and take BSI precautions, do my scene size up, determine if it's safe to approach. As I'm coming in, considering nature of illness or mechanism of injury, sounds like a nature of illness here. Determining number of patients, I see one patient. I'm going to go ahead and call for advanced life support because the nature of illness is difficulty breathing. How you doing? I'm Mark with ABC Ambulance. What's going on today?
I was playing, what was I doing?
You were playing, yeah, keep rolling. Whatever you were playing.
I was playing soccer and all of a sudden I was having a hard time breathing.
You're having a hard time breathing?
Yes.
Okay. You didn't fall or hit your head, you don't have any neck or back pain right now?
Nope.
Consider possible spinal injury. I have a poor general impression because this 21-year-old male should not be having trouble breathing right now. ABCs are in fact intact as he's speaking to me. Okay, sir, I'm concerned about your difficulty breathing. Mind if I start taking a look at you here?
Sure.
All right. Right off the bat, I'm going to go ahead and check his radial pulse, get a quick respiratory rate, looking for external bleeding, and getting a good look at skin color, temperature right now. I'm also going to direct my partner to place this patient on a non-rebreathing mask at 15 liters per minute. My partner's going to give me an oxygen mask, see if this doesn't help you out. He is most assuredly a high priority based on his nature of illness and the fact that he's having difficulty breathing. I'm going to go ahead and direct my partner to obtain baseline vital signs while I interview this patient. So my partner's going to check your blood pressure, pressure on your arm there, okay? I'm going to direct my partner to examine pupils as well, recheck heart rate and respiratory rate and skin color and skin temperature. When did you start having trouble breathing?
Just about 15 minutes ago.
Okay, and you were engaged in a soccer game, huh?
Yes.
Okay. Does anything make your breathing condition better or worse?
No.
Okay. Observing for rise and fall of the chest as I was doing while I was watching the airway to make sure there is in fact rise and fall of the chest and good quality of air movement at this time. And you said you're not having any pain anywhere in your body, right? Or,
No.
Okay. Describe your difficulty breathing. Rate it for me on a scale of 1 to 10.
I'll go with a 7.
Okay. And is the difficulty breathing intermittent, constant? Is it getting worse?
It's constant.
Okay. And has this ever happened to you before?
Yes.
Okay. What happened before?
Exercise-induced asthma.
I see. Okay. Do you have a prescribed inhaler for this?
I do.
Outstanding. I'd like to make sure I said I would call for ALS if I haven't. And right now, my primary concern is his severe difficulty breathing. So I'm going to collect up his vital signs. I'm going to contact medical control. I'm going to go ahead and inspect this meter dose inhaler to make sure it's the right medication for the patient. It is in fact the right medication, the right dose, the right route of delivery, non-expired date, and the right time to give it. I'm going to contact medical control and let them know that it's EMT Mark from ABC Ambulance and that I need a doctor for orders, and I have a 21-year-old male that is having severe difficulty breathing at an athletic field. He does have a history of asthma, and right now the evaluator is going to say to me, you do not have enough information for medical control. And I'm going to panic. Oh my God, what did I forget? I'd like to do a recovery. What would you like to recover on? I'd like to do my sample history and then recontact. Noted. Okay? Signs and symptoms. You having difficulty breathing. Okay? Are you allergic to anything?
No.
Do you take any other medications besides the inhaler?
Nope.
Okay? Do you have a past medical history I should know about besides the asthma?
Nope.
When's the last time you ate or drank something?
About an hour ago.
Okay, and you said you were playing soccer when this happened? Oh my God, I'm sorry, I forgot to do sample. Relax, relax. Now try medical control. Okay, so I'm calling medical control again. I got Dr. Cost too much on the horn here, and I can tell him I got a 21-year-old male. He's got a history of asthma. He's having severe difficulty breathing, and he does have his own meter dose inhaler, but has not used it yet. His vital signs: his blood pressure is 130/70, respirations are 22 and labored. Heart rate is 120 and bounding. He is slightly diaphoretic at this time, and he is in fact breathing on his own. I'd also do a focused exam of the lungs, listening to lung sounds, where I've identified wheezing in both lung fields. I'm looking for permission to deliver 2 puffs of his meter dose inhaler to him, and I did check the R's. Obviously, it is the right patient, right medication, right dose, right route of delivery, has a non-expired date, and it is the right time to use it. Okay, EMT Mark, Dr. Cost Too Much is giving you permission to deliver exactly 2 puffs from the patient's metered dose inhaler. Understood, Dr. Cost Too Much. That's 2 puffs from the metered dose inhaler. Okay, sir, here's what I'm going to do. I know you got the oxygen on right now. All right, I'm going to shake this medication up really, really good. I know you've used it before. I want you to take a deep breath. Get all your air out. I'm going to lift this mask up, and I want you to inhale deeply. Hold your breath for as long as it's comfortable. Okay. You ready for one more, sir? Exhale. Take a couple of breaths. One more time. Mask back on. I'm going to go ahead and document what I delivered to the patient and the route delivery. Because I have a poor general impression, I would really like to get this young man into my ambulance right now and en route to the hospital. When we load him on the stretcher, we're going to get him into position of comfort, which in this case is probably going to be sitting up semi-Fowlers because he's having trouble breathing. In the back of the ambulance, I would reconsider the nature of illness, which I believe right now is exercise-induced asthma. I will reevaluate my initial assessment, again paying close attention to mental status, airway breathing, and circulation. I would go ahead and direct my partner to check his vital signs every 5 minutes because he is a priority patient. I would consider a detailed physical exam, and I didn't say that in the last one, folks, but I don't think he needs it. I will continue my focused exam of the chest and ability to breathe and listening to lung sounds. I will reconsider my transport decision. He's still a high priority. I'm going to observe this patient for changes in condition. I'm also going to treat him for shock by keeping him covered up and keeping high flow oxygen on him. And I will treat him for shock, I'm sorry. My clinical impression of this patient is possible exercise-induced asthma event. My treatment for this patient is through. If you have any questions, always state, and I apologize,